Clinical communication skills are gaining a lot of importance in the medical field. It's quite difficult to pin down exactly what communication skills are, but effectively it is the way that doctors communicate with each other, with other healthcare professionals, with relatives. Bedside manner is probably the more commonly known term that people understand, but clinical communication skills involves a more structured, evidence-based way of communicating. Hi, I'm Adriano. I'm a clinical lecturer at Queen Mary, Malta. I'm very passionate about clinical communication skills. I've been passionate about this since I was a medical student, and now I love seeing the journey that our medical students here take and improve in their clinical communication skills. So we begin clinical communication skills in year one with patient-centered interviewing, where we learn about understanding what patients need from doctors and from consultations, and how to incorporate these into our medical questionnaire. Our final year, during the 5th year, we go through how to break bad news to patients. Most of clinical communication skills is taught using unscripted patients, where we actually get to practice these conversations in a safe environment. Many people and many medical students do believe that clinical communication skills are something that you either have or you don't, but actually, like any clinical skill, clinical communication skills are something that you can learn and practice and improve in. And the amazing thing is that you can also use the skills that you learn in your everyday life, not just the clinical world. I want medical students to know that there are many options of what one can do after getting their medical degree. Many people think that it's just about becoming a surgeon or a medical doctor in a hospital, but there are so many other options, including things like research, working in medical education and helping transform medical students into future doctors. I think we all know that medical school can be quite challenging. I understand that completely, having been there. As a lecturer, I always advocate to my students to find time to release some of the stress and to perform activities to alleviate some of this stress. Ultimately, we want our students to graduate with not just competency, but also to be happy and to have had amazing experiences here. Thankfully, Gozo is a relaxed island. It's sunny most of the year. Students can enjoy a 1-hour break walking in the countryside or just enjoying the sunshine. It's a great place to learn how to enjoy your life while also working or studying. As a discipline, clinical communication skills is always evolving. One of my favorite things is meeting other lecturers from other universities who also teach clinical communication skills, sharing ideas about how to teach and how to deliver the syllabus. I find great value in actually talking to our graduate students and asking them what they wish they were taught more. What I do with this is I try to incorporate this into our clinical communication skills syllabus for our current medical students. Queen Mary is so much more than just hitting the books. It's about training to be the best doctor that you can be. So we really hope that you can join us here soon.